thing I'd like to do is see if we can use anything that comes out of this meeting that we could publish as some advice, guidance, pointers for other IRM members of this group to use. So in terms of some objectives, what I'd like to do is that we have an open debate and we share the experiences that we've had over the last few rather unusual and unprecedented months. Think about some of the lessons we've learned so far in terms of identified risks and opportunities, control and mitigation strategies, whether they worked as we thought or not, anything that we found about decision making, governance and ways of working, and how helpful deployment of traditional risk assurance frameworks have been, whether we've had to change those, and then have a thought about how should we best prepare for, I'm going to call it a new normal rather than the new normal, because there may be a changing normal, and then what does the emerging risk landscape look like? And in my mind, I'm thinking that could be one of the chief things we could get out of this meeting. In terms of an agenda, I was thinking this is broadly it, but it won't be exactly this, but that's the kind of order I'd like to follow, and we'll take as much of the time as we need to do this. So maybe move things around, but I guess what I'd like to do is start this with a group or people just quickly to introduce themselves, their role, the organisation they work for, and any specific objectives you might like to get out of this session. Now, I think I'm working on the basis if I stop sharing my screen, people will be able to see each other's screens, but I don't know if I'm working on a faulty logic, but I'll stop sharing for the moment and I can always put it back up again. So I'm not quite, traditionally we kind of go around a table, but I guess I need to go around a virtual table here. So if people introduce themselves and role and what they're looking to get out of today, if there's anything in particular, and we'll try and achieve it.
Who's going first?
Okay. Whoever would like to. Well, I tell you what. Shall I do it from what I can see on my screen? And if I go in a logical, to me, order. And I knew they used to. I know when I tested this, I shouldn't admit this. I know when I tested this, I could see how I could unmute people. So I'm kind of going to hope you can all unmute yourselves, because I now can't see that button that tells me how to do that. So I'm going to start. I'm just picking on somebody in an order I can see on my screen. So Tina Perkins. That's rather worrying. I've just seen membership at the IRM has left, so I was hoping they were going to tell me somewhere. So I think that's just telling me about what I.
Well, what about so Steve? I can see that Katherine, Kendra, Lina, Michelle, Richard, Manton, Tina Perkins, and Valentina, but none of them have switched their webcam on.
Right.
Can you guys chat if there's so Valentina has now, because there's an alphabetical name. So I can see that Catherine's on unmute, but and I know that she's typed in. Could anybody else potentially put themselves on webcam? Are you happy to do that? Aha, Kendra, there we go. I think it might make it easier for Steve if he sees people in front of him.
Yeah, that's true, but I can still see, Kendra, for example, that you're muted, and I'm trying to see how on earth
Catherine
I
there,
get.
fantastic.
I unmute. I'm looking at settings and all sorts of things, and there was an obvious button when I tried this out.
Well, we could start with the people that we can see.
Kendra, I can see you can speak now, so sorry. Yeah, okay. Kendra, are you happy to go first?
Yes, of course. I'm a corporate risk manager at Gateshead NHS Foundation Trust. And I suppose really it's just having been doing part of a risk role throughout this, and then part of it being sort of moved off onto sort of dealing with the COVID-19 mailbox and things like that. I feel as though it's been a very bitty in terms of what I've seen and the experiences that people sort of feedback, and as you're talking to different people, what they're saying. So I think really it's just sort of to try and get other people's experiences of what they feel is going on, what we need to do going forward. I think that would be really helpful.
Thank you, and thank you for going first. Robin, I can see you as I'm going across my screen next. You look like you're muted. If you're happy to unmute yourself,
Yep, how's that?
Great, thank you.
Good. Right, just very, very briefly, I run a company called Safety Zone. I really just work by myself. Well, I do work for myself, not really. I do work for myself. I'm not sure whether that's just because nobody else will work with me or what, but never mind. I have as I say, it's mainly health and safety, but of course, business risk management and risk management is all in there and all in the one, isn't it? Really, there's no join, there's no gap in the middle. And I suppose really I was, Kendra, the same reason, just keen to speak to hear what other people are saying, what other people's experiences are. I think we all, with the separation that we've got in the isolation, maybe we all feel quite dislocated and disassociated from what's really happening. So I was really just keen to be part of this and hear what everybody else has got to say and hear what you've got to say, Steve, and things like that. So. I generally work for very large organizations. I tend to get called in when things have gotten a bit of a muddle and I have to sort them out. So that's really what I do. That's me.
Right. Thank you, Robin. I'm just going by the people I can see on camera so far. Good idea, Amanda. Katherine Scanlon.
Hi everyone. So yeah, I'm Katherine Scanlon. I work as a risk manager. I actually work for a telecoms company in Shoreditch. They're called Colt. But the reason I'm member of this group is for a number of years I worked with Bupa, the health insurer, and so I joined this SIG a few years back. But again, like everyone else has said, or like Kendra and Robin have stated, I've got a keen interest in health and safety. I work with the health and safety team quite a lot, and we're looking at kind of how COVID is impacting some of our countries in Europe and things like re-entry projects. Whether it's safe for staff to go back to the office and things like that. So that's kind of my main interest. But so yeah, not working in the health industry directly, but would be working very closely with our large health and safety team for our company, and as I said, based in Shoreditch, but we have operations all over Europe.
Okay, great. Thank you. Amanda, do you mind going next, please?
Of course, yes. So I joined this group recently when I became a non-exec for Mid York's NHS Trust. I've been part of a COVID-19 assurance group. So we have got quite a lot of insights and having to be receiving assurance on risk practices and so on. So hopefully to share some of those and what's actually been happening on the ground. I was in the NHS when I graduated over 30 years ago, working for a large trust, but I was a bit disillusioned with the NHS then. So I have actually developed a finance and then further on a risk career, working for large insurance companies. Direct Line was on the board there, GE Capital and so on. So I've seen risk, I suppose, and been on various boards. So I've seen it in different perspectives. I'm also a non-exec and a school governor for a special needs school. So there's been a lot of risk stuff going on. And it's almost, let's say, what the textbook should have been, but actually this is what happened. I've got all of those I could potentially share, but I will concentrate on the health ones. But I am interested to know how things appear from a risk manager perspective. And the key thing for me is to understanding why is it we sort of move, how I felt is the risk management function, if you like, seems to be being put on ice, and all those good things happening, and operations have taken control. And I would really love to explore as to why that happens, and actually even at board level with my colleagues, why they might think, well, that's what happens, because that isn't how things happen in different sectors. You know, it's more that they are more drawn upon. So I want to understand a bit about why we think that might happen in health, and has that been the same experience for you guys?
Thank you. We'll try and cover that. Valentina, hi.
Hi. So first of all, apologies because it doesn't say my surname. I'm so used to our internal meeting. I just put my name. It's Valentina Cappo. Steve, nice to be in this meeting with you. I'm Corporate Risk Manager for Imperial College NHS Trust. And I also chair a network of NHS risk managers in London. I guess what's interesting for me, well, kind of similarly to what Amanda said, is there was obviously lots of focus on operations, and it felt like the risk function was kept outside. The difference is our board actually has been asking a lot about risk and how we manage COVID-related risks. But at the same time, on the ground, it didn't seem to be a priority, and therefore I'm interested also in other people's experience with regards to balancing the management of risk while things are done with the actual capturing risks and kind of the paperwork that goes with it and the assurance evidence collection. But also, I think it would be interesting to see what other people see in regard to what's coming next. And what's the risk horizon with all the recovery and reset and all of the big work that, again, are going on operationally, and how other organizations are managing this from a risk perspective.
Thank you. Hi. Tina, I can see you've come on the screen, so could you just briefly introduce yourself and give us a bit of background about your role and what you'd like to get out of this session? I think you may have, Hi, Tina, your microphone's green, but I can't actually hear. I don't know if anybody else can, sorry.
That better?
Oh, yes, that's good. We can hear you now, thank you.
Yeah, I've changed the settings. Everything you go on seems to be a different setting.
Yeah. As I'm finding, yes, exactly.
We're mainly using Microsoft Teams, so they've got. Yeah. We're not using Zoom, so sort of taking that off a lot of things from just a security perspective. It's one of the things that we're trying not to use. So you just end up changing settings every time you use it. Yes. I'm the Health and Safety Risk Manager for Northamptonshire Healthcare NHS Foundation Trust. So we're the community mental health services across Northamptonshire as a whole. And my role picks up both leading on the health and safety in the organisation and leading on corporate risk management, which has been rather a challenge through the COVID situation because there's a lot more work than there normally would be. So I think really what I'm looking to see is what other people's experiences are at this point in time. We're particularly looking at our organisational risks and the impact of COVID on those, and in fact, what are our risks going forward and what should we be making sure we're managing well, and really looking for insight from others as to what they think will be the next level of risks as we go through recovery.
Thank you for that. I can see we've got some other people and maybe having challenges with their screen, so I'm just going to go in the order I can see people, which may or may not be the same as everybody else. So Richard Manton, are you able to come on and just briefly introduce yourself?
Hello, can you hear us?
Yes, we can.
Hi, so my name is Richard Manton, Risk and Assurance Manager at University Hospitals of Leicester. So here with my colleague as well in the office, so JD Marr. So we've sort of been involved in the sort of COVID response as well. So we've sort of been pulled in to sort of help with the sort of tactical cell and the sort of planning and response to that. So we've sort of been doing sort of two jobs, if you like, in one, which is not unusual, I suppose. I suppose what we're sort of looking to sort of try and, you know, find out a little bit about and get into the discussion around the sort of emerging risk landscape. So, you know, the new risk going forward. Also then a little bit about how perhaps, and Amanda might be sort of useful on this in terms of her board level sort of experience, how sort of risk has been managed at board level during the last sort of 2-3 months. Has it sort of been overlooked, if you like, or has it sort of come to the sort of forefront of the agenda? And then obviously sort of looking at perhaps how going forward any of those changes might be opportunities for improvement with sort of corporate risk, organisational risk, and BAF as well. Thank you.
Thanks, Richard. Looking who else hasn't spoken. Michelle, sorry, I don't have a surname.
Hi, can you hear me?
Yes, great, thank you.
Excellent. Sorry, I'm having some bandwidth problems, so I've turned my camera off. I hope you don't mind.
No, that's fine, I quite understand.
Yes, so I'm Michelle Hazard. I used to be head of corporate risk for NHS Improvement. I did that for about 5.5 years. So I left probably in March and joined Ernst & Young to sort of look after their enterprise risk management team, covering the health sector and central government. Excuse me, yes, so I just joined today really just to hear what other people are experiencing, the issues, the sort of innovations that you're seeing in the risk management space, and just have some conversations around that really. So my two main jobs that I've got on at the moment, obviously being a consultant and in the middle of this pandemic, are both NHS jobs. So one of them is the NHS Nightingale Northwest facility. So I'm heavily involved in that particular one. And I'm also helping an NHS trust and cancer charity in Wales navigate the current climate from a risk management and corporate governance perspective. I just wanted to sort of hear and chip into what other people are experiencing.
Right, great, thank you. And I look like I've just lost somebody, but who I was just about to introduce. But so, is there anybody on the call that I've been so rude to have ignored so far? And apologies if I have, because I can see 9 of us if I include myself on the screen. So if that's, please chip in if there's anybody else that I can't see for whatever reason. Thank you for that. And I realise I haven't properly introduced myself other than to say I'm chair of the special interest group. I currently head of corporate risk for NHS Digital, and I'm also a public governor for Harrogate Foundation Trust. So I guess I can't remember if all of you working for trusts are foundation trusts, but if you are, you'll sort of know the concept of a governor as an extra layer of governance and assurance. And that's something I should be carrying on, because I actually retire from NHS Digital at the end of June, but that's probably too much information. I will carry on with this group, and hopefully I may be more successful in getting more meetings organised. Anyway, so similarly to you, I was sort of conscious that we'd made so many decisions at great speed over the last few months, you know, within our own areas, and in our case to help do our bit to support the wider system. But I was sort of wondering how far we had thought about risk and controlling those decisions, whether there was some catching up we needed to do, and then particularly what we saw as the future risk landscape, because it's inevitable that the environment that we're going to operate in going forward is going to be completely different to anything we envisaged back in January, possibly even a little bit later than that. So in terms of, I won't, unless it's helpful, share the screen again. So I guess as a starter, just anything anybody would like to share in terms of risks they've encountered over the last few months, how, if not specifically, well, I suppose I do mean, yes, how well were they managed, but were they managed in the way that you expected they were going to be managed beforehand? Did risk and assurance frameworks help? Did people talk about risk as risk, or did people just sort of crack on and thought they'd worry about risk and control afterwards? And any particular opportunities as well of risks that we've identified? Because one thing that I would say is we've seen things being delivered more at pace, and that might suggest that we could continue with that if we could find a good way of doing it. So would you like to kick off, Amanda?
Yeah, so what I'm going to do is just very high level, because I don't want to switch people off and give people, so I can answer questions if people are interested. But I can say what I saw very high level. So, and I think you'd be able to relate to this. So immediately that the things started happening, there was a desire by the board to say, what are the things that we stop doing and what are the things we carry on doing? So that's like a tactical decision. So from a patient perspective, first of all, they looked at everybody straight away was very quick to say, we already have staff issues and we are losing quite a significant proportion of staff, if people remember, who were symptomatic. So things that we noticed in terms of a patient perspective was there were fewer people coming through A&E, but there was a lot of worried well people and a lot of uncertainty about what we would have to do, and PPE was a big thing. So what the board decided to do was to say, of all of the non-essential data, and there was I suppose the executive proposed to us what they're going to stop recording. So there's a number of things that we do internally in terms of our information systems that we stopped collecting. That has meant, and the impact of that is we are not tracking performance data for things other than our statutory, our requirements, and we are a requirements improvement trust at present. So straight away we cut back on all our production, and we had to redeploy people. So we didn't have the people necessarily collecting it and recording it. So a number of risks flow out from that. I'll just cite one because your imagination can go on, but the main thing is people start doing things in processes and adapting to perhaps doing virtual clinics and so on. And we know that we won't have been capturing a number of things that we are doing, and we're not recording the things we're not doing. So straight away, the overall performance and actually what's happening with the trust and the level of detail we're used to, we are not getting that. And the information team, not all of them, but some of them, have been redeployed into the business to use their planning and recording skills to focus and reprioritize their time to record decisions and meetings. So what there has been an increase in is day-to-day communication operationally, and there is a heck of a lot of stats and information returns that need to go externally. Mainly that there are so many returns from the ICS, from regional, from national, and so on. So there was a change in information production, and there's a redeployment of staff. So we know that there's going to be risks in terms of things will happen, and we won't understand the full impact of that over time. But what we have done is say we think we're recording the critical things and the decisions. In terms of delegations, we had to decide that actually a number of things, we changed our delegation to say certain things would be done at executive level, and we set up an assurance board every week, and we would go through all of the key things, and literally that information focused on all the tactical things that are happening to the response to COVID. And we have had to make, I think the biggest thing is the decisions being made ahead of consultation with trusts. So I think as a provider, there has been difficulty in guidance coming out and expecting it to be implemented. And there's a couple of things that I know that we probably ended up, like PPE, we've gone against the grain because we'd have run out of gowns, so we turned to local suppliers. So that is a typical type of material thing that's happened. I can tell you that risks that pop out as a result is, for example, this is where risk management would have been really helpful from a corporate or knowledge perspective rather than just doing. Know your customer is just basic risk management. If you're changing supply, know your customer. And I think I sat on the board thinking there was oh, we bought this, but it's not fit for purpose or such and such. So we know, I know that there will have been some waste. I'm not quite sure that it's in the big grand scheme of things significant, but I'm just sort of being open to say the things that might have come forefront of mind as me in the past as being a risk manager from that perspective might not be in the skill set of somebody facing this problem, taking on supplier redeployment. So what we will have is we will have imperfect decisions or less efficient decisions, and it will cause waste. And I think going forward, something like PPE, there's a big decision to say, we can see why it didn't work with the national system because it was just in time, and as soon as the supply chain was broken with everybody else doing their own thing and actually not being able to see what came into on various orders because people didn't know what they were getting, consignments and so on, I would say nationally, and feeding it out, that entire just-in-time system broke down, and so there was a need for people to just literally make some decisive action. So we sort of assured ourselves retrospectively after key decisions. So that is the sort of I mean, there are so many other things that did happen, and I think to make sure I say, did this happen to you? Did this happen to you? You could probably ask me those questions, and I could give you something specific. I've also had the benefit of having a full report of the things that I would say the trust from an executive perspective feels important, and those things are the resetting of services. We have had to close, we got 3 different sites, close services, move services. We've literally reconfigured estates to maximise the opportunity for patient care and get stuck with there's pressure to start cancer services, for example. So what's actually happening is risk committee meetings stopped happening in the formal get-together share. What stepped up was the fact that the level of decision making and documenting those. So I think there was, I'm not on the ground in this one to hear but how I see it, risk committee meetings didn't happen, which I think is a bit more of an assessment and a bit of a control check, but actually the actions were happening. So it's that I think people understand their risks and understand about what decisions they got to make, but the push to make those decisions probably went to the right places, but I think we're going to have to go through and have a look at. I received hundreds of decisions that got made at our last sort of 3-month summary of what's happened. So they have all been recorded, and I think that's the important thing. What I notice is we don't have what is the impact of that. Was it I wouldn't say a bad decision, but was it the best for the trust? Did it follow strategy? So there's a whole range of assessment that needs to happen. So what I saw was a very comprehensive governance, but it shifted decision making down, sort of like the control moved into the organisation. My question is, And I think this comes down to how good is our capacity, not just for learning and development, but for handling stress-wise mental health issues as much as skill set. If you've got a really highly skilled workforce, I think this would be something that quite a few people will have done well at. I suspect it might highlight where we've got more from a people-based perspective, areas of weaker local decision-making, knowledge and so on. And I think we'll only start being able to look at all that data once we actually come up for air, if that makes sense. So effectively, I would say as a board, we've done our best to ask the right questions for summary information about how we're dealing at an overall level, how we're managing support with and lobbying things to give us the best opportunity for service for our patients. We have worked more closely with partners than ever, such as care homes. We are a community trust as well as an acute trust, and also MPs and so on. And I think that has been really helpful. There's a certain level of trust that's been built inside and outside that meant the communication was better. But I'm not quite sure about if there's been anything significant that will come out in terms of what's not happened. Of course, our performance stats have gone down because we've not been able to diagnose people and run some of those services. And I'll stop there. Is it? So I'll stop there. I don't know if anybody's got any questions or wants to go next.
I think you're absolutely right, Amanda. Certainly that's what I have seen. So it's around how those decisions to cease activity have been made, how you can evidence those, on what basis were those decisions made. And certainly from my perspective, what I'm helping organisations do now is actually do a bit of a retrospective review into those decisions. There's a lot of organisations, of course, are just waiting for a subsequent review into this to occur. So, for example, if you've ceased a particular activity, if you've loosened particular controls as part of your process, if you've moved to a governance light basis in your organisation, have you documented that change in your control environment, and can you now reinstigate it? And of course, lots of organisations are looking at this as an opportunity actually not to go back to old bureaucratic practices, because as you've said, you know, they noticed that risk management really was used in a different way through this crisis and was actually a lot more tactical. So as you say, a lot of decisions and a lot of information flows through those historic risk management committees, that sort of thing. The decisions were made outside of those old bureaucratic systems. So really what a lot of organisations are trying to do now, are asking themselves now, is do we need to go back to that model, or is there a different model in this new normal which would allow us to make decisions faster, which would allow those risk-based information flows to come to the right committees, the right board members, executives in a faster paced way. So absolutely, I agree with everything you said. So definitely I'm helping people do a lot of decision-making matrices, really re-looking at all of those old risk management practices. So for example, have any of you looked at your risk appetite tolerances as to help you make decisions as we've gone through this crisis? 9 times out of 10 people are telling me absolutely not. You know, we've been firefighting, we haven't even looked at them, opened those documents up. So really it's looking at what you've got in place. So your risk appetite strategies, frameworks, tolerance ranges, your risk operating model, 3 lines of defence, is that working for you? Has that come in useful? Have you relied upon that to help make these conversations work and to help make these decisions? And as I said, most people are saying no. And so really it's, asking themselves, well, why not? And can we tweak them? Do we need to tweak them now? What would work in this new normal?
Yeah, thanks, Michelle, because I certainly think part of the debate today and going forward has got to be what's the role of risk and assurance processes, functions to help for the future. I'm interested also about the risk appetite point, because it feels to me intuitive that risk appetite must have changed.
Absolutely.
But I've been told by others, I won't say where, that no, of course our risk appetite hasn't changed. But yeah, but we made that decision anyway. Sorry, I can see Valentina wants to speak.
Yeah,
so
no, I
I'll
just had a comment actually, because I probably misinterpreted what was said. But I think it's quite normal that organizations would have told you that the risk appetite strategy didn't help during the crisis, because the crisis has actually shifted the risk appetite for most organizations.
Exactly.
So even in terms of patient safety, there was an element of decision making, like canceling all the appointments, and even during the recovery, how appointments will be prioritized is completely different from how it was 3 months ago. So for sure, the strategy hasn't helped, the strategy that was there, but that doesn't mean that the risk appetite strategy is not helpful. It just means that there's been a huge crisis, and which has shifted everyone's risk appetite, and we need to look at our strategies and readjust them based on the new normal. That's my,
Yes. Yeah. Sorry, I trying to get off mute appears to be a challenge. Apologies for that. Yeah, no, that's great. So clearly there's something about decision making and what further future risk and assurance models should look like. And I will try and summarize today as far as I'm able and subsequently. But any other views, sort of risks that you've encountered, how they've been managed, how we've had to adapt normal processes, the normal risk management approach, and so on, governance arrangements.
Can I just make a couple of comments? I probably come from quite a different angle, and it's really interesting to hear what Amanda's been experiencing and things like that. This is what I wanted to get out of this. While I say I do sort of risk, health and safety and risk management and stuff like that, a lot of what I get involved with as well is organizational development. And basically, it sounds a bit harsh, this, but what I find is that, and what I'm seeing with quite a lot of organizations, is they were fairly dysfunctional organizations in the first place. Whenever you put a dysfunctional organization under crisis, then they just become more dysfunctional. And logical thinking goes out the window. It all becomes fear-driven and stuff like that. So this is why risk management and the clarity that risk management brings, the disciplines that risk management brings, is becoming more and more important. But whether these people will hear it or not, boards are always a struggle, because really you're often relying on not professional people, or the professional people that don't actually have anything to do or experience with what they're actually trying to deal with boards, And it's back to the old gifted amateur approach. I don't know if you come across that expression before, but they can be a huge hurdle on a board, unfortunately. So not sure if any of that helps.
Yeah, that's really interesting. So certainly what I've been also sort of noticing is, to me, it has highlighted a little bit that risk can still be a little bit siloed, and that, truly enterprise risk management definitely helps in this kind of a scenario. I do think that it has shown that many organizations don't build in the capacity to respond to those unlikely but potentially devastating events that COVID-19 obviously has turned out to be, and also failing to prepare for such catastrophic events hitting many organisations at once. So going back to that whole risk interdependencies angle, so certainly I think that was certainly something that I noticed. So lots of people, for example, were discussing, was COVID-19 a black swan? Was it a grey rhino? And it's a really interesting philosophical question, of course. But really, I think what probably, if it was any of those things, it's more the grey rhino, isn't it? Everyone knew that there was a potential. It's on the National Risk Register. Pandemics they've been on there for the last, 5-10 years. But actually, seeing how it's impacted multiple organisations globally across the world has been what the black swan is in this scenario. So really linking risk management with business continuity. And also a lot of the clients that I'm working with, their number one risk at the moment is, of course, workforce. And that's all of my NHS organisations. They're all screaming red workforce risks at a strategic level. So really, certainly from my point of view, also COVID-19 really has thrust, communications experts, human resources experts, they're really suddenly finding themselves being asked lots of difficult questions by boards, by executive teams, where previously in the past they maybe weren't first in line. The same for business continuity. That has really thrust the business continuity, comms, HR disciplines into the spotlight alongside risk management. So it's how we interact with all of those other specialist control functions in the future and really determining do the sum of the parts equal the whole. That's something that's going through my mind at the moment as well.
Okay, thanks, Michelle. Sorry, somebody else was going to speak then.
It was Amanda. I was just going to say, so I'm not doing, so here in the NHS, it's what's difficult for me is obviously, I think most people may or may not be familiar with the BAF framework, which is the top level risks that are centrally done, and obviously patient safety, all those things, patient outcomes and so on. And I think that what's happened is the clinicians who actually are the people that I suppose at the front line to deliver those, they're making, as ever, the clinical decisions. And actually, I won't say leading, but we do with the chief operating thing. There is really good response to the imminent crisis. I think it's a little bit more around the impact. What doesn't get done is, I suppose, is saying the boring thing. What is the impact or the unintended consequence of that decision? And that thought is happening after, rather than a little bit of dialogue before. Now, I could be supposing that, and I'm only making my judgment because it is a case of, with the facts I'm faced with, I'm going to do this because it's so imminent, this decision, and we'll look at it. And I think it's so important when we look onward at these decisions, which are the ones where actually we should make sure that we don't make it's worth waiting another hour or two, 24 hours or so on. So it's almost like we've done a test of our rapid response, and we have utilised where we think the skills are. So I think the board has done the right thing to do that. But there will be, I think the point is, there will be unintended consequences. And we don't have a specific risk function in our trust. It's all sort of managed. And I think when people come to the risk committee, it sort of devolved in the fact that people talk about the risk issues. It's not, in my mind, and I'm still like a bit of a lone voice here, it's not developed in the sense of a mature risk framework that I'm used to with key risk indicators and so on. It's very much about making sure the executive understand what the risks are they're managing and reporting their actions and thinking about, do their actions fit with strategy? To me, that's risk issue management, but trying to look back and sort of, and I know the thought process is there. I think it all comes down to what's the sensible proportion of time we should be spending talking about risk issues compared to the more valuable thing of what's looking ahead in terms of how's our partnership risk changed? How's those things? And those are the things that are really important, because actually the NHS is going through a massive transformation as it is anyway, with PNCs coming in and so on. We have to do something about how care is given in various pathways. So what I can see is there has been an acceleration of people coming together to focus on something like cancer pathways. I think there's more dialogue that will move certain things forward. Doing virtual appointments has gone up. More than 50% of our appointments now are virtual, and I think we won't go back on some of those. But I still think that what I like, maybe I just live in a box, I quite like having the old-fashioned, whether it's a pestle or a SWOT. What are all our risks, and how have they changed? I would look through our board agenda, and I'm not quite sure at what point we would look to do that. Now, I've just joined the audit committee, so my view is that I will use the audit committee, my relationship with internal external auditors, to have those dialogues, and those have stuck in place, but obviously they're quarterly. So I think it's important that from a board level, it is about the sort of people, the interest they have in those things. Because in my head, I'd like to understand the entire risk universe, if you like, and like I said, I've only been there 6 months, and then have a better understanding of actually how do I really trust people's judgment of where we are in that risk universe, and where does their appetite sit. What I don't see is a lot of that type of dialogue, if that makes sense. I see an awful lot of risk management, because everything is probably I wouldn't say a crisis or an issue, but there is so many things that aren't being done, and they're aware of the risk to the patient and so on. So does that give a bit of context about it's possibly more about the amount of time and the maturity of that dialogue, and making space for that, and compared to traditionally lots of assurance and performance management of things, and making sure we communicate those. There is a subtle difference.
Thank you, Amanda. I'm beginning to wonder, there's something about, so there's what happens on the ground, and then how does that link with the view as it goes up through the organisation and reaches the board, I think. So sorry, any other views on how we've managed risk, what the value of risk and so on has been in the current climate, the current crisis we've been going through?
I can give sort of my view, Steve, in terms of sort of what I've seen. Certainly in terms of function, sort of, we saw very much function stood down, very much as Amanda was discussing. So in terms of the sort of the routine risk management, in terms of the maintenance of the register, the reporting side, all of that sort of was very much sort of stood down. We sort of, even in sort of patient safety in terms of incidents, and this was very much focused on the fact that staff would be so busy on the front line that they don't have the time to investigate or be managing risks and doing the sort of the I suppose that documenting and recording element of everything. So it was very much that they would be sort of so busy they wouldn't be able to do that. But that was at a point before it had become that busy, and it never did get that busy. So it was very much sort of standing down things that actually what you needing to do is ensure that clinicians and everybody on the floor is actually, it's in their mind to still report incidents, to still look after risks, to still be making sure that they've got those controls in place. And I very much felt that standing all those things down was sort of going, this isn't important. The only thing that is important is the staff on the front line, and that we've got enough staff to cover patients. So I found that a really difficult thing to sort of try to think, well, how do we come back from that and get people to start going back into that routine of making sure they do record things?
Yes, it's sort of getting back to that almost that more of a business as usual. Now that's a bit yes, that kind of feels disappointing, and I understand. I can kind of see in one respect how it happened, because the messaging from the centre was all about, focus on the front line, and we're at risk of getting swamped. But yeah, it's how do we get back to, well, I said earlier, I think maybe it's a new normal where we carry on doing those things. Maybe we find a different way of doing them. I don't know, because those things are still important. It's getting a structure to decision making, making sure we've got sufficient information to know what is going on. Any other thoughts? Anybody who's not spoken as yet?
If I could just.
Hi, Richard. I'm sorry.
Oh. I tell you what, Richard. So Katherine, do you want to go first, and then Richard? I'll use the judgment of Solomon here.
No problem. No, obviously I said to you all that I've never worked for the NHS, so I don't have that healthcare background. As I said, I did work for Bupa for a number of years, but just in terms of my experience, I've been working in London now for about 9 years, and I've always been in risk management roles, predominantly in the insurance industry, and I said so a number of years with Bupa. But I think just from having kind of, since I've left university, I've been in risk roles. It's kind of all I've ever really done. But I think companies, in my opinion, have reacted very well to the situation, and I think a lot of my friends and things and colleagues I know of, are happy with how their employers have treated them during this lockdown, and working from home facilities, etc. But just from a risk perspective, I mean, emerging risks, business continuity, health and safety, they're all kind of key areas of passion of mine, and I just feel, whilst black swan versus grey rhino, I think we knew it was coming, but we were nowhere near prepared. And I mean, you could argue how prepared could or should we have been, but I feel that we had, for a known issue, we just weren't prepared enough. And I think that's a sweeping statement against kind of everyone. I think nobody was prepared for how big it was, and with emerging risks, they're like, oh, that's on the long finger. Whereas I feel like it should have been something that should have been thought more deeply, I think, really. So it's more just a general statement, but I just feel, as a risk professional, I feel like something that's been on our radar for so many years, we just were nowhere near prepared for it.
I agree.
Yeah,
interestingly, I was just thinking, it'd be interesting to sort of know how many organisations are doing any kind of scenario planning for a potential second wave.
Yeah. Because I feel like the profession I've been in, and business continuity and crisis management just does not get enough attention. People, it's never in anyone's interest, and then when something goes wrong, you've got the big execs saying, well, why hadn't we this done? But yet they're the people you can never get the involvement of in the testing phases.
Yes, I think engagement is critically important. It's what, for Kendra, you see, if we had a risk function, I would have just been asking people to say, are these people being involved in key decision making? Because it shouldn't be about necessarily always reporting and follow up. This is about making good decisions. And the reason we have boards and the reason we put people together is because different perspectives sort of tease out what's right. And we've changed decision making. So to me, are risk managers decision makers, and I think they should be contributors at various levels. So I think we could have encouraged people like Kendra to sort of step up and sit on perhaps core exec. It's those sorts of things, and that's a real shame. The point that Katherine was making, I will say that only this week it has come out to all providers, I believe, from Matt Hancock. We've got to be prepared for an extra 20% capacity for this winter. Right. All I can say is, myself included, because even I've come from a mainly different career background, and I think the response was sort of a bit aghast, really, because that's estate. We've redeployed, changed estates, the way we pump oxygen, all sorts of things. But actually, that is massive, and I'm not quite sure. So if we think about the new thing, it's actually I think there's been an ask. I'm not quite sure what, I think the main response from the region is going to be highlighting we need to be consulted and so on sort of public announcements. But like I say, I think one of the big things we have is the NHS as a public body. Our biggest risk and threat is speedy decision making at the centre, and again we're not at the table, and actually getting ourselves ready for that. What's the expectation? How's it being thought through and discussed? So, and actually I think about, I'm horrified, but that should almost say it should be replicated lower down the organisation, where people should be horrified that they have not been in, if we've not managed to utilise people in an organisation in this crisis, there's something wrong there. So I think that really needs to be looked at.
Yeah, thank you for that. So Richard, you were going to say something a few minutes ago.
Yeah, I was just going to sort of, I suppose, sort of just back up from an acute perspective, sort of how we sort of managed it. So again, sort of very early on, I think we, as an organisation, took down the sort of non-essential meetings, which is sort of a grey area, what's essential, what's non-essential. But that was sort of worked out and worked through. And I think that we've probably then started acting in a slightly different way. I suppose normally a lot of risk management is sort of reactive. So then it was about how we become more proactive. So we sort of set up, in conjunction with our sort of emergency planning team and operations team, we set up sort of different cells, and a tactical cell, a strategic cell, and then out of that there were sort of branches of, infection prevention, demand and capacity, supplies, all that sort of thing. So we did some sort of, I suppose, high level sort of risk management work there to identify what the potential hazards are. And then we sort of work with the relevant leaders in those areas to sort of work up, actually, what are we doing now? What more can we do? What's potentially going to happen and trip us up? And we use that then as a log, really, at our daily tactical meetings. And they were chaired by an exec lead. And actually, there was quite a lot of good decision making going on at those meetings. That was then escalated through to the strategic group, which is the executive directors, and on a weekly basis we would basically update our corporate risk around sort of COVID that would go to our chairman and non-exec directors. So we were sort of trying to maintain the risk function in that sense, and actually it was becoming more proactive. At the same time, we were also quite keen to make sure that we didn't take our eye off the ball on other non-COVID issues and risks. So again, sort of looking across incidents and that sort of thing, we'd provide a sort of a weekly report to our exec team that was focusing on perhaps sort of some of the non-COVID issues, just to make sure that, again, we weren't sort of taking our eye off the ball on anything there, and sort of any problems occurring there. So that worked really well during our sort of process. I think that we've probably had a higher number of risks on the risk register with elapsed review dates, perhaps. We've recognised that some actions are going to be paused, so we've sort of worked with colleagues to sort of recognise that. In a sense, a lot of the hazards from COVID were already perhaps on our risk register. So in terms of themes, if you're looking at sort of workforce, if you're looking at equipment, if you're looking at sort of demand and capacity, if you're looking at the estate infrastructure, all that sort of thing, they're on there. So what we sort of suggested to people is, actually, rather than sort of creating a whole new set of risks, they actually start to sort of update and make live what they've got. So again, there's opportunities there, rather than sort of recreating something, to use what we've already got. And that again also sort of helped us to identify any necessary gaps. I think decision making was a lot quicker on a lot of these things. Obviously that helped with the sort of the blank check on equipment for a period of time, which again, we could sort of suddenly replace equipment and get equipment in, which was sort of beneficial. But there's I think quite a few sort of changes that, when we do actually sort of look back and reflect, we need to sort of learn, and we need to sort of look at actually how we did it then. Can we do it differently going forward? We're trying to sort of change our risk register at the same time, so we're sort of looking at moving to a different program. So we're looking at how going forward, some of the changes that we've perhaps made during the last 3 months, how we can feed those in to that process. I think the sort of the assurance element has been quite key as well, and I think here, probably the majority of hospital trusts probably had a pandemic risk on their risk register or on their BAF, but actually, how much evidence had they got about the fact that they've got a robust response plan in place that potentially looked at increasing ITU capacity, etc., etc. I think that the assurance element is something that we've sort of really taken away in terms of how much evidence are we actually providing to perhaps audit committee. Are they asking the right questions? Are we providing the right information to actually sort of demonstrate appropriate assurance, rather than just sort of having a plan on a shelf but not actually being fit for purpose? So I think that's some of the learning from our point of view.
Okay, thank you for that, Richard. I know this is being recorded. I'm trying to take notes as we go, so I'll try and reflect on some of this in a second. Although I am beginning to think about the comment I think it was Michelle made earlier about perhaps we focus more on scenario planning, and I guess I'm reflecting that I used to work in a outside of the NHS, but in a central government department back in the 2000s, and one of my areas of responsibility was business continuity about risk. So we had developed a pandemic contingency plan, and that was in the build-up to, if you remember, swine flu. But it kind of feels like we breathed nationally a bit of a sigh of relief after that, and thought, oh well, that wasn't as bad as we thought. So I wonder if somehow we didn't quite realise how bad this was quickly enough as a personal perspective. It does make me think we need to make sure we do more about scenario planning, but I'll try and summarise this in a bit more. Any other observations about how we've managed things over the last few months? I just want to make sure I give everybody the opportunity to. Oh yeah, sorry. Who was that? I seem to lose something then. I'm sorry, Valentina. Sorry, it's my where my cursor is.
It's okay. Just a question with regard to what you just said, and I think Michelle mentioned earlier. So I'm curious to know if other organizations have a close collaboration between risk management and business continuity, and if not, whether we think this is something that should happen in future. Because I think that personally, I don't work close enough with our business continuity function, and this is something that I was reflecting upon over, the past couple of months, and something that I want to build on. And I wonder if this is something that is similar in other organizations, or probably other organizations differently.
Thank you. That's a good point. There may be other functions that we could perhaps integrate more or work more closely with, but I'd be interested in others' views about this.
I absolutely agree, actually, Valentina. So before I worked for the NHS, I worked in finance for about 12 years. And when I worked in finance, certainly I managed a team of risk managers and business continuity managers that covered the entire enterprise. So certainly in finance, they were more aligned. Because for example, the business continuity team, as part of their business continuity planning, would do a risk assessment, a process risk assessment, for example, and they relied on a lot of the techniques that the risk team, that the risk peers, the tools, techniques that the risk team could facilitate for them. So certainly in finance there was more crossover and cross-utilisation of techniques and outputs from those risk assessment exercises. I haven't seen a great deal of that in the NHS, if I'm honest with you, until now. But I must say, you know, one of my previous points was that the organisations that I'm working with now, they really are, you know, hand in hand with the risk team, the business continuity and resilience team, the comms team and the HR teams are starting to work more closely together. But again, my fear is once we get through this, is that going to revert back to old habits?
Yes, that's always a worry. It's a bit like that sigh of relief. You breathe and think, well, we've got past this. And yes, I'm probably the only one old enough that can remember public information films. And there was one about a family that had a burst pipe, and they dealt with it really well. You know, they switched the stopcock off and all this jazz and cleared the house out, and then they were sitting down with a nice, you know, well, we dealt with that really well look on their faces, and the little strap line that came over at the end of the film was, okay, so why did you let it happen in the first place? So you'd really dealt with a crisis, and I think there's a lot about risk management there. But yes, I kind of have a worry. We feel like we've got an opportunity to reset things. Mm-hmm. We don't want to slip back. So one thing I would like to talk about before we finish is, you know, what we think about the future nature and role of risk management is. But as I think I predicted, I think I've blown what I said was the agenda, but I'm really happy about the input that we're getting, so I don't want to stop that. So anything else that anybody would, you know, like to say about how things have gone? And I think maybe well, sorry, no, I'll just pause there. Well, we can go backwards and forwards in the agenda as we wish, but I guess what I'm beginning to think about, and I think we've touched on some of this, about current concerns and what people see as the risk landscape going forward immediately, and as we go through the next few months, and dare I say even years, because it occurs to me that one thing's going to happen. I think at least one person's already mentioned this, but you know, I hate to say it on a warm day in June, but you know, and as somebody has said somewhere on TV, I can't remember where, winter is coming. But winter is coming, as it comes every year. You know, we may get you know, another wave or waves of coronavirus, and gosh, I was trying to avoid having a risk chat without the B word, but you know, we've got Brexit coming, so we've got an accumulation of things coming, and I've always had a thought that we tend to deal well with individual risks, but when a few risks come at the same time, that seems to be when we have more problems. But it feels like we've got a potential perfect storm, dare I say, building up. So I'd be interested in knowing what people's current and future concerns, thoughts about risks that we're likely to be faced with going forward.
Yeah, Steve, just to follow on what you're saying there, I fully agree that I fall back on a lot on my psychology stuff here, and it's well known that from a psychology perspective that people deal with magnitude well, but they struggle with complexity, and all that's happening in the near future is the complexity is going to increase, whether it's oncome of winter, COVID coming back or continuing, Brexit, then we're going to have all the issues fairly soon around about the costs, whether that's organizational costs or whether it's government costs. There's going to be a huge number of factors coming in that are going to make it a lot more complex. And as I say, people struggle with complexity.
I think that's a very good point.
Thank you.
I was also going to say one of my biggest concerns is the thing a bit like PTSD. We actually had ICU come into one of our virtual boards. One of the women broke down in the team as she was reliving how horrendous it had been. So I think there's something around, that's the negative side of things about, will people cope with it potentially going off the scale again come winter? If we're being asked to prepare for more capacity, we've got norovirus, flu, other flu pandemics and so on. The positive side, and when you're saying what can we do to look forward is as we, in any organisation that's so big, I know in our trust there's nearly 9,000 staff, and I can say that though there's values that are shared by quite a lot of, you know, like in any organisation, it's always, there's various ends of the scale. But there was actually quite a lot of trust built in terms of the support and well-being we gave staff. So what about what we think about of all the positive things and such as face-to-face appointments and getting things online with your local GP or establishing a new relationship? We always think about risk, potentially there's going to be some hazards, but there's also, we should list here definitely the opportunities. What happened? Our IT program shot forward enormously to get everybody using, you know, we have to turn up for board meetings, and it's a case of it felt very alien, and people, you know, felt that they needed to be with each other. But we should list all the positive things, and do we think, which one of those do we think we could take forward that delivers a better organisation?
Yeah, that's a very good point, because we do tend to focus on the threat rather than the opportunity side, and I think all the risk textbooks talk about opportunities, but to be honest, I mean, I've been a risk manager formally since 1998, and it's always been a challenge to get people thinking about the opportunity side of it. And one thing from ages ago sticks in my mind, and I apologise, I'm probably going to mispronounce this, but I understand that the word risk comes from a medieval Italian word risicare, which means to dare, which kind of might make you think differently about it. So there are the two sides of the coin. And yes, I'll be honest, we're NHS Digital. Obviously, we've done a lot in a safer manner as possible about sharing more data, as well as more digitization more quickly. And the number of people I've heard saying, well, actually, I've been trying to get that thing to happen for the last 17 years, and suddenly the doors are unlocked. So I think there are some positive things. I think there's a bit of I think, I don't know if it's you, Amanda, I like the phrase about retrospective assurance that we might need to do about some of the things that we've done. But think, well, we could do things. We could do things differently. So I think it's right to think about, what can we do to make things better, and, for want of a better phrase, talk about opportunity risk.
I just keep thinking about Kendra and thinking, gosh, how can she really get a name on that in that organisation? And I'm thinking of, if she's seen things that's happening that, like you say, have been stuck there because sometimes it's too risky to do that, it's too risky, some risk tolerance, or somebody has been a blocker to something happening, something that touches you, can you get it under your thing and proactively say, this is great, we should roll this out, we should increase this gives us greater opportunity, better outcomes, and yada yada yada. To start stamping your own sort of capability back on the agenda about let's take away something that was too risky before, but actually we've proven that we've done it, and we can tolerate that risk, and it gives a better outcome to move forward. It is thinking about how can risk managers be shown to add value to making good decisions.
That's a good point. Yeah, thanks, Amanda. Valentina, you were going to say something.
Yeah, it's just a reflection, because I agree with both of your points, Amanda and Steve. But like when you were talking about opportunities, so first of all, I do think there has been some looking at what we've done well and what we can carry forward. So for example, with telephone or online appointments, so many organizations will be keeping those to some extent. But I think what's also enabled to be more risky, like less risk averse, because it's true that NHS organizations, I think, are generically quite risk averse, and I think it's part of the nature of our business, and I think it's part of the fact that most organizations do not have, are not very much mature with regard to risk management. So they are quite reactive and they react to threats rather than looking at opportunities. But at the same time, when we look at opportunities, I think we shouldn't forget that a lot of what happened quickly and well has been enabled from much less regulatory pressure. So for example, even my organization, you know, the whole organization was able to use Microsoft Teams within a weekend. But that was also supported by the fact that NHS Digital was a little bit, you know, more understanding if a big incident would have happened. I mean, we shouldn't forget these things, because a lot of bureaucracy, it comes from the fact that we are a very heavily and rightly so regulated industry. So I think a lot of change is good that obviously will be looked within organization, and is being looked for sure in my organization. But a lot of it will have to come from regional and national level.
Yeah, that's, yes. I think, yeah, it's almost it's probably the wrong word. It's almost like a permission from the centre that you can do these things. Do you mean it's permission's perhaps the wrong word, but it's like any other thoughts? One thing I was wondering, which is sort of wearing my governor hat, is you know, what's the experience been of working with the integrated care systems for those of you that do? You know, has that been something that's been, I don't know, maybe too early to say, is that something that's been of benefit? Has that helped with the decision making? Has it helped with how we dealt with things? I realised at relatively early stages, a lot of them, but okay. So I'm just keeping an eye on the time now. I think this is going to be. Sorry, was somebody just about to say something then? Apologies. This is. I have to say, I have to say this is one. I'm not particularly talking about the virtues of Teams, because NHS Digital tried to rolled it out. But the one thing I have found that's been good with Teams has been you've got the ability to raise a hand, and I can't see how you do that on this, other than if you're on the screen, as Valentina did, you lift your hand up. So apologies if I miss anybody. So do holler or use the chat. But I think there's something about you know, it feels like we, you know, very quickly came out with, I'll try and summarise this better in a note, but we took decisions quickly. There's something about how well we evidenced those and got assurance on them, and any of the unexpected consequences or impacts. We changed delegations and working practices quite quickly. For the longer term, I think there is something about looking at risk appetite generally, and that might be something that we need a permission from the centre about potentially. I think there's something about integrating risk and other functions like business continuity management a little bit more. thinking more about scenario planning, engagement with senior management. I will do a better note, but I'd done a quick, let's see if I can go back to that bit that tells me how to share my screen, just to show something I'd done earlier, because there's something is there a Microsoft slide showing there? I hope there is. So this is a little bit busy, and I did some thinking about future areas of risk, and I'm happy for any of these to be removed, shot down. I'd particularly be interested in anything that we might be missing. I'll leave them up for a minute, but I think there's something about, well, we do need to think more about resilience and contingency planning. I think at least one person said earlier about the supply chain didn't seem to quite hold up as might have been expected. There's going to be something about cost and funding, because I think, and correct me if I'm wrong, I think so I just realised I didn't click the button that said share. Okay, right. Hopefully now you can see what the heck I'm talking about. I think there's something about, as I understand it, that at least immediate costs from dealing with COVID at trust level and so on are going to be funded, but I guess that's not going to be, that's going to be forever ever and a day, is it? I would imagine. I think we said there's something about the way I phrased it, something about, I think there's something generally about staff well-being and fatigue, because people, and you've all coped fantastically. I've got so much admiration for everybody working in frontline, and not just frontline positions, but there's only a limit that you can carry on doing that. I seem to remember reading ages ago the book about Apollo 13. Can't remember before or after Tom Hanks' film about it, but anyway, but it was the thing that they did. One of the things that struck with me, that they didn't always have the same people dealing with the crisis and making decisions. They they had them almost in shifts. So I know that's not exactly the same situation. I do have a thing, a genuine, this is a personal thing that I suspect I'm not alone, that we need to think more about. So how are we going to integrate social care in with healthcare? Because I think we don't do, well, with evidence, we've not done that very well, haven't we? Just, I'll say it. Continuing pace of innovation, continuing sharing of data, but while still keeping the right protections in place. I guess my perfect storm comes in here to an extent, because of course we have got a huge backlog in treatment of non-COVID conditions that we will need to try and clear. Will have delayed other activities, not just from a medical perspective, but capital projects, other change projects. I mean, where I work at the moment, we're going through a prioritization process, and again, we need to be have risk at the forefront of our mind there, because there are some things that we're going to do that will deliver genuine improvements to patient care. I think there's something about partnership working and how well integrated care systems are working. So sorry, that's just a bit of a canter and a gabble through all of those, but I don't know if any of those chime, or whether you think there's anything we could do to add to that set of future risks. And I guess if we set our horizon over the next 6 to 12 months,
Sorry, Steve. I can't hear you now.
Oh, Oh, right. Okay. Sorry.
Steve, you came on and went off again. Sorry.
I'll try not to touch that again. I think when my cursor hovers for too long near it, it switches my microphone off as well. So apologies for that. Yeah, so that was just my view about some of the future risks, but I'd welcome your views about what those might be and opportunities. So I slipped back again, didn't I? We can easily do that.
Could I just say something, Steve, about your mention of Apollo 15, A13, should I say? I'm not sure if many people follow a lot of what NASA has dealt with over the last 20, 30 years. But one thing to remember about the Apollo 13 team, the guys, the astronauts themselves, they were all trained pilots, they were all trained test pilots. So they were used to dealing with crisis. They were used to dealing with risk at the highest possible level. And that clearly paid off for them in the Apollo 13 because they kept sticking to the facts. They didn't get emotional about things. They kept sticking to the facts. So, and I think that there might be something to be learned from there.
Yes, that's a good point. Yes, absolutely. And again, if we reflect on the SpaceX launch, the two guys that went up in that had been space shuttle pilots before, so they were
so experienced there,
well trained,
and I would suggest that is the struggle that people are going to have with risk management and etc. in the near future, is you're going to be dealing with more and more people that are going to be thinking emotionally rather than they're going to be thinking factually. Anyway, that's me bringing the psychology in again.
No, but well, I think if we're looking at risk and business continuity management, psychology is, and the way people react is vitally important. Sorry, Amanda, you were going.
I was going to, because I was interested about Richard Manton, who was talking to us about his experience in, I think it was Northampton. I was just wanting to know how developed the leadership team, and I don't mean the exec. I mean, throughout an organisation, we hear about how important leadership is, and obviously the skills go in with that. And Richard, how well developed are your leaders right all the way through the organisation that have sort of, I would say, an inclusive and welcoming, proper, rather than command and control, which I know has its place in terms of listening mode, to taking on board different perspectives to work with you guys, and just to confirm, is your background clinician working in risk, or is it more, it's definitely from a risk background working in the field?
Right, so I think that what sort of probably benefited us is that early in the year we did a lot of work with our emergency planning team to look at our command and control structure in the trust. So at the end of last year, start of this year, we did lots of training to our, so instead of directorates, we've got sort of clinical management groups. So we've got 7 of those, and they've got a clinical director and a head of operations and a head of nursing. So we did a lot of training to all of those staff members in those particular roles. So then when this incident, when we became clear that this was going to become an incident, we linked in with those people, and that's where we then set up the tactical group, which met on a daily basis for an hour, 2 o'clock till 3 o'clock every day, and we had a set agenda and it was an opportunity for them to almost sort of actually talk through what are the risks that they're going through at the moment, and what do they expect to sort of or anticipate in the next, 12 hours, 24 hours, week, 2 weeks, 3 weeks, that sort of thing. And we put that into a sort of a sit rep template, because there weren't enough sit reps at the time. So we sort of did that, and we got the sort of clinical management groups to actually then fill that in on a daily basis. That then sort of helped to feed into our things like our escalation reports. So where we needed to sort of escalate matters that we were sort of going to foresee, about PPE in a week's time, 2 weeks' time, that sort of thing. So I think there's a combination of the fact that the training that we did at the start of the year, I think then as we sort of went through the process, we worked out how do we make this as easy as possible for people to actually explain and identify their risks and tell us what those are, and also try to sort of give us the solutions that they're thinking about, rather than perhaps as perhaps in the past where people bring risks to a table and then have a number of discussions about what, it's almost a case of bring your risks and your solutions. And that tactical group then almost was sort of given the authority to sort of make these decisions, and sort of work with the strategic group, because our sort of tactical lead went on to the strategic group every day to sort of again sort of explain what decisions had been taken. Does that sort of help?
Yeah, that does. That helps, because I think we've got the same governance. My interest was as to the fact that they saw you as a critical part of their decision making and discussion, rather than keeping it just amongst the, they wanted your involvement, and it sounds like that is because it's a relationship that is being built up by the fact you're fairly integrated through the training, and probably there's other examples. And I think to Steve's point about going forward, I think there's a big point there about, I can't remember if you'd already put it on your list, but in my mind it is about extending relationships and deepening understanding and trust with others, not just the people you think have the expertise. It's thinking about which are all the dimensions of making solutions. It sounds like that you're a go-to person and value add. I think that's what risk managers want to and need to be in an organisation.
I think that early on, I think we sort of sat down. I know I sort of sat down with our emergency planning manager, and very early on we set up our sort of tactical cell. And at that stage, we had a number of people in that cell, and we asked the questions then, which were sort of at times the straightforward questions about what's happening now, what's going to happen tomorrow, what's going to happen next week. And then we started to sort of plan them down. And I again just made the comment that actually, we're doing risk management in a slightly different way to what we've done it before. But it's good the way that we're doing it. And that then sort of helped. And we then started to sort of define it. So after a couple of days, we sort of, the tactical calls that were sort of potentially running over by half an hour, we said, right, it's by exception only. You bring in what you need to discuss here and what you need a decision to be made on. And that's where risk comes into it, because actually risk management is decision making, isn't it? It's making sure we make the right and good decisions, and we've got evidence to support that. So I think that's the approach that we sort of took quite early on. I think that we did the right thing. We got the right group of people together, and we sort of managed that in a way that actually through the CMGs or the directorates, as other trusts might have, they had to sort of have an escalation process to get it up to their person who was coming to the tactical meeting. So again, that worked quite well, so that we weren't potentially having, very, very early on, we had a meeting in our boardroom where we've had probably about every CMG was represented by probably 3 or 4 people, and it was standing room only, and you've got all your corporate directorates as well. And it was ridiculous because actually, an hour meeting didn't work at all. So very early on, we learned that that's not the way to do it. We've got to sort of change it. So that's when we then said, all the, you know, the CMGs need to create their tactical cells and escalate their issues and risks through that. And I say issues and risks because some of them were issues that could be dealt with quite quickly, and some of them were true risks that actually we needed to look at, perhaps make an investment in, and it wasn't going to necessarily change overnight, that sort of thing. But I think we did that quite early on, and then we've carried that on. You know, we sort of steadily, or they're stood down slightly, so we know we have 3 times a week now meetings rather than sort of daily. But we linked in with people like our comms cell, so we had a comms person on the call, so we had a daily briefing that goes out to all staff. So any sort of key decisions that were being made, you know, things like mask fit testing. So we very early on we identified we didn't have enough masks to carry on doing mask fit testing with our preferred masks. So very early on we sort of got a message out there. Now if we hadn't got that message out there and worked with staff and reassured staff, potentially, you know, we could have actually sort of seen people almost not wanting to go into a COVID area because they weren't assured about their or reassured about their PPE. So we sort of did a lot of work, and we sort of tried to almost think of the things that could potentially trip us up and then start to sort of put those in. And that's when, again, we identified potentially opportunities as well. Of course, an opportunity might present a risk, so we looked at it from that point of view as well. But it was trying to balance living in the moment, making decisions to make the right decisions to progress things, and having that, you know, evidence and assurance as to why we've done that through the process.
Well, yeah, thank you for that. Because that's, well, sorry, I don't want to stop anybody else from speaking, but it's kind of feeling to me like that was a really useful, but also a good segue into something that I don't think I'd explicitly, if I could say the word, explicitly included on the agenda, but we've talked about it a lot throughout. What is the future, you know, what should the future role of risk management be? What lessons can we learn from this about the way that we work, the processes that we use, and how we engage? I mean, we've been dealing and are still dealing with a huge crisis. So how do we take that way of working into day-to-day business management when, you know, we're not dealing with a crisis that's in your face?
I would suggest, Steve, that the first priority is, do you have a learning organization to start with? If you haven't, then it's going to probably go nowhere.
Yeah, it feels like Robin, what you assess your organisation for its maturity. So we're going to embark on a massive thing of change again, using an institute called Virginia Mason Institute, and it's important to understand where your organisation is and assess that, and risk managers are quite good at assessment. So in terms of looking at your resilience as an organisation for risk and future, what that's going to look like in the land lives, it seems sensible that you would first of all properly understand how your organisation is in terms of not just its risk management processes, but there's been, I think the IRM has definitely shared things in the past that sort of say we're immature or we're on this part of the curve by what you see and how it's being managed. And then you can look in the next box and start trying to find who are the people that are going to help you move that organisation, because Robin's got a very valid point, whether it's change, whether it's risk or something else. Having a great idea is very difficult to put in if people aren't sort of saying, well, what's in it for me type of thing, whether you've got the right leadership and that. So I think a lot of this, my personal view is a lot of this comes down to the culture in that organisation, the expectation, So although you've laid the expectation, do people behave in that way? So I think first part of risk management is to really understand their organisation and the people in it. And to be fair, I actually think that is underdeveloped. That side of things is underdeveloped as a risk in itself, in terms of culture measurement and everybody operating from the same page. I don't know what other people's experiences are in their organisations, but I would say that's a challenge in the NHS.
I would agree. Any other thoughts about that?
I would agree with Manda, you know, and it's not just the NHS, which is just really everywhere. The different agendas that go on is extraordinary. Trying to get everybody to the one agenda, the one purpose, the one mission. Very, very difficult. Very difficult indeed.
But does that say that risk managers have potentially got a role in doing that?
Yeah, I personally think that we have to, you know, risk managers are a bit like health and safety people. We sort of almost have to merge our skills. We have to become, need to bring it all there, all in the one. It's a bit like a continuum, you know, you can't just have one or the other. And that's what I was hearing at the beginning of this talk, you know, that it might have been Richard that brought it up or somebody brought it up, you know, where, well, I think it was yourself actually, Amanda, where certain things were falling by the way.
Yep.
We need to be able to do all of this together is the only way it's going to work. I can't really explain that any further, but it needs to be that collective approach, that all working together. But certainly, yeah, risk managers have got a lot. Well, it's probably a quite critical approach, isn't it? Or not purpose, really, isn't it? Risk managers, because we're just, as a nation and as a world, we keep stumbling into more and more crises and dramas and things like that. If we don't start controlling those fairly soon, whether it's the climate, whether it's Brexit or anything like that, the situation is just going to get worse and worse. So yeah, risk management is really coming into its own now, I would have suggested.
I mean, what I'm hearing is Valentina.
Yeah, no, I just wanted to say, yeah, no, I also agree with what Amanda said earlier, but also that there is, obviously, it's very important to have that leadership support, because because it really is a lot about the risk management culture of the organization, how much the risk management function is involved and at which level. So if there isn't that leadership support, the risk manager can try as much as they want, but they will never succeed. But at the same time, yes, there is a responsibility of the risk manager, because the risk manager should write a strategy that includes all of that and try to sell that strategy to the executive and the board to make sure that pervasive representation of the risk management function exists in the organization to really support enterprise risk management.
Yeah, thank you. No, I agree. Well, one thing I was thinking was hearing you all talk was, I know I'm talking about a specific thing here, but the words that were coming to my mind was that the risk manager is almost a system integrator. System integrator is probably the wrong word, but it's to pull things together. Maybe that's what we should be looking at, and I agree, Valentina, actually being an evangelist and selling the benefits. You would like to think that what we've just gone through would make people more receptive to it, but again, I think somebody said earlier how we avoid kind of slipping back to say, oh well, that wasn't that horrible, but we're kind of okay now, which in my humble view was kind of what happened after swine flu, but other countries had SARS and MERS, didn't they? And it feels to me like they had learned a lot of the lessons, so they reacted better than we do. And I'm not meaning to take a view here, but I mean, I think we were we not scored very highly? Us in the US were scored very highly in terms of our preparedness before this started, but and there's something about theory meeting practice, I think, and I think risk managers have got a role to say, well, at the practical end, you need to think about these things. I suspect I'm not articulating it that well. So kind of in the last 10 minutes, any other thoughts others have had about areas of risk, how we should take risk management forward in the health and care sector?
Steve, can I just come in there on your last few comments and say that it's widely recognized that the two countries that could have dealt with the COVID-19 well, America and the UK, are the ones that really haven't, which is quite strange. And the other thing is that I think what risk managers need to do now is, as they say in health and safety, they say you can have the perfect paperwork system but never have it fully functioning. Yes. I think that now is the thing, it's got to be made fully functioning.
Yeah. So the paperwork links.
How interestingly, working with an American company and also seeing it trying to blast its way into Europe, one thing I did learn when I was at GE is relationships really matter in Europe. So in the same way that when I've come onto an NHS board, and obviously I'm an outsider, to start talking about risk and get invited on the audit committee, I sort of didn't have to be risk. What I had to do is show compassion. There's numbers of hurdles, if it makes sense. So, for example, I'm keen to really understand the people in the organisation. So I asked gentle questions and very supportive questions to the HR director. And then we've built a little rapport where I feel comfortable and he feels comfortable just for me to picking up the phone, because I'm not really getting the, it's behind in its KPIs compared to probably other functions, and where I've seen like full organisation design and so on elsewhere. But there's a lot of understanding and desire to get there. And I picked on someone who really does need more voice to influence others. So I think with anything, when they pick your battles, pick people in a small way, small step, to make an influence and do something impactful as a result of COVID. Have a look at something, do a great piece of work, and just put yourself and your function, if you're in a place where it really needs to have more share of voice. And it just goes back to basics about listening to what other people, it's like a relationship, isn't it? Listen to what other people's needs and wants are, and you have to utilize your skill to sort of say, how can I improve? What is the risk I want to improve? Who are the people involved? How will I get their stakeholder buy-in? What is it that needs to happen? So it is, you have to be a bit of a strategist, play the long game. But that's what risk professionals should be good at, because they understand that they've got a vision about where they want risk to be and how it should look and feel. And we should share what that looks and feels like in a good organisation, and think about some little milestones. So I think there is a great opportunity, but it's going to take some courage and some self-confidence to increase your share of voice in your organisations.
Thank you. Any other thoughts about risks and the way that we should operate in the last 7 minutes or so?
I think it's already been echoed, but I think from a risk perspective, I think as a risk professional, I think COVID will present, or once the kind of situation dies down, I think it'll provide, incredible opportunities for us to, become more involved in the business and, to help aid more risk kind of based decisions rather than, getting involved into the business earlier in, whether it be a sales project or, an expansion project or something like that. But so I think there's a great opportunity, but my concern would be is that people are quick to forget, and so they'll, once things kind of go back to normal, will they just kind of go back to old habits? Now, I think COVID will definitely change how people act in the definitely short to medium term, but more, I don't know, the 3 or 5 year mark, will people just have forgotten and, you know, risk are at the back burner again? So it'll be interesting to see how that one pans out.
Yes. Yeah, there is definitely a memory issue, because yeah, I could name organisations where I've worked where sort of got things sorted out, and one I've got in mind isn't. I'm not saying it's because I'd left, but it's a bit like they kind of got to a point where, you know, you've gone and forgotten all those things that you did so well to recover from that that crisis, which involved, which I won't mention the name of the organisation, but it involved queues around passport offices. So let's leave it at that. So that was a little while ago in my in my past. So anything else anybody would like to share? Thoughts about future meetings? Does this, as we get more practice in it, does this format a meeting work? Because I suspect this is the way we're going to have to meet for quite a bit of time going forward. So does this format work? And I'm particularly interested, are there any other topics people would like to cover? I think there's a load of stuff that's come out of this, which I'll try and process and distill, which I think will give us some topics for future meetings. But I'd be really keen to know what other people would, what other things people would find of value to them.
I think we should have, it's probably my fault, so I think we should have talked in terms of like putting discussion things on the table, but I think we should look at the system, how we change the fragmentation, what's happening in different regions. And I know it might be difficult for some people to see that, but I think it's a good stretch thing for people to find out about what's happening in your region with ICSs, PCNs and so on. Do people think that looking externally to partnerships externally would be a good one? I don't know. I don't know if it's.
No, actually, I think that would be a good one. Certainly, I think the partnership working has increased a lot. Partnerships that I think initially before COVID were sort of slightly tenuous, and there used to be a little bit of friction, seem to have smoothed over a lot, and there's been a lot more working sort of with the council and the communities much more. So I do think looking at the wider and sort of environment in terms of how sort of the health and social care being delivered would be quite useful.
Steve, I'm not sure if you've got anyone. I'm not sure if you've got anyone from DHSC or any of the other, like NHS England, as a member of this particular group. So when I was working in NHS Improvement, I used to attend a DHSC ALB risk network. So the risk managers, heads of risk for obviously DH and all of its arm's length bodies met a couple of times a year to share good practice in the risk management space. And they also had a responsibility to talk about interdependent risks impacting across the system. So for example, I know one of the interdependent risks they were talking about when I was still there was, of course, cyber. So that might be a good piece of insight for someone who still goes to those committees to sort of bring some of that conversation to this group, just so we can hear about, you know, what are those conversations like at the moment, which would be really interesting. And also from my time in NHS Improvement, I do know that a lot of the government bodies, or the chief risk officers for DH and its sort of peer organisations, were talking about competencies. So whether or not across the health and social care system should we look into whether risk management should be a stronger competency for board members down. So I know that was something certainly that DHSC risk programme and performance management director, she was looking into that one. So that certainly, I think that one could be an interesting one, because that sort of talks about what we were mentioning here today around, you know, some of the stronger organisations that I've seen, you know, from a risk management maturity point of view, accountability for risk up, down and across the organisation has been really, really strong. So that was certainly the most impressive organisations from a risk management point of view that I've seen. They really do live and breathe risk management. So you could actually go and speak to the chief nurse, the chief medical director, and they could tell you, you know, as much about the risk process as the risk director. Certainly that's the most impressive organisation that I've seen, or sort of the setup or the operating model that I've seen. It works really quite well. So I think linking into that sort of competency-based conversation around risk management in the health and social care space would be an interesting one to bring back to this group. I might still have the names. I could sort of send them over to you, Steve.
Yes, that would be good. I've got some context in NHS England and so on. I think the that arm's length body group for the DHSC seems to me to it meets it has a bit of a flurry, and then but we definitely need to get some input from there. But any contacts you've got would be great, and I can add them to mine. So about the view to the centre, external partnerships, competency, and something we were talking about earlier, maybe assessing maturity might be something useful as a model that we might be able to use. I do say that with a strong question mark.
Yeah, that might be helpful, I think.
I think you're on mute again, Steve.
Oh. I think. Can you hear me now? I might have just gone quiet.
Yeah.
I might have been. That what you might have just seen demonstrated was me trying to think. So. But you may have heard a noise if you heard me thinking as well. Anyway, but no, that's great. Anything else? Either we'd not covered, and other things you would like us to cover in future meetings. I mean, if you have thoughts afterwards, let me know. I'll try and distill this and put a sensible note out, and also speak to the IRM about getting, if you're all still okay with it, getting this recording put up on the website so you can refer back to it. I kind of quite like a note myself, but I know other people might like to listen back, or other people who've not been able to attend. Well, thank you for all your active participation. If anything occurs afterwards, please let me know. I'm happy to have separate discussions with anybody about anything. Thank you again for all your input, and I will do my very best to get another meeting. This kind of seems to have worked okay as a format. I just need to be a bit better practiced at operating the dials and levers and so on, but we'll certainly be doing things in this format for a little while, so I'll try and progress some of those ideas you've